to make the uterine incision. Chromium. Baby blanket. Baby ball syringe.
Heads out. One minute alive.
Can I cut?
Yeah.
All right, clamp. All right, cut. Baby's out.
Baby's coming.
Heads out.
Baby.
Cyanotic, meconium. Porcelain.
Let's get a good suction. Dried stem. Can I have the hat here?
Oh, let's clean them first and then look at the hat.
Take this
Got
sample.
cord blood. The Nemo, I think. What do we have? Our breast sounds?
Lifting baby.
Breast sounds are coarse crackles. You get the hat.
Coarse crackles, keep suctioning. What's the heart rate?
Heart rate is 60 and dropping.
2 and breathe.
30 seconds, then we'll get a pulse check.
1, 2 and breathe. 1, 2 and breathe. 1, 2 and breathe. Are we ready for a pulse check?
All right, let's get a pulse check.
Okay.
It's rising, but it's still 50. Let's get one more set of compressions.
1 and 2 and breathe. 2 and breathe.
Let the baby on top.
Alright, scratch one, hypo one.
Alright, let's get a weight.
1, 2, 3.
Alright, respirations are
4.
stable.
Here? Alright.
We can stop positive pressure.
Where's the baby?
It's good,
Baby's good.
stable.
Baby's good. Stable.
Heart rate.
Tallies, I have 1, 2, 3, 4, 5, 6.
There should be 2 off, 1 on the baby.
Oh, both up?
Yeah.
Okay, one on the baby, 1, 2. Yep, good.
All right, next layer.
3, 4, 5, 6, 7.
What did I do yesterday?
Down 20.
Full one, blade 1, 2, 3.
Yay.
Yeah, I need the ABD. I need
Okay.
4x4 Telfa and a large outside.